Kyle, and welcome to Insure Your Health. I'm on Black Point Insurance, where we help Medicare beneficiaries nationwide learn about the A, B, C's, and D's of Medicare, and we help agents and brokers learn to launch, grow, and retain their businesses. Insure Your Health is a very dynamic show that brings together industry experts from all different areas of healthcare onto the show. So sometimes we bring on carrier providers to do carrier spotlights. Sometimes we bring on the health plans. Sometimes we bring on an industry expert to teach us about a compliance. And one of my favorite segments is when we provide you with a physician segment, talking about some of the most premier physicians in the industry that come and talk to us about all the variety of health topics that are out there. And I am so excited to introduce my guest today. Dr. Jagmohan Khaira is with me today. Dr. Khaira actually founded Marina Village Medicine that's located in Alameda County, and he is amazing. He's a very busy physician, so I'm glad that he took time to meet with us. And he really believes in building a strong core between patient and doctor relationship to deliver right to the value of care that he's looking to provide with his services. He really takes the time to get to know his patients, to ensure they're getting the best quality possible healthcare and the best healthcare experience available. Dr. Khaira is dynamic in his field. They're growing and taking patients at his practice, and I am so excited to bring him from backstage and introduce them all to you. So Dr. Khaira, welcome to the show. How are you?
I'm great. Thank you, Erin, and thank you for that really lovely introduction. I'm feeling very humbled by all your kind words, and really appreciate it. And thanks for letting me be here today.
You got it. We're so excited to have you. And when I think of a quality physician, I just think of all the compassion you bring to all your patients and the huge skill set that you bring. And that dynamic duo, I feel like that's you. So we're so excited and welcome to the show. So glad you could join us. So tell us your life story, Dr. Khaira. How did you become a physician? Why the specific passion for primary care? How did this all come about?
Well, I think it really starts with, with my parents. My parents and instilled in me, a desire to give back to my community, give back to the people around me, and to the greater community. They were immigrants, new to this country, but they wanted to give back. They sensed the importance. They knew the importance of that, and they passed that on to their children. And so for me, getting into medicine was just a way of essentially providing, in a way, charity every day, because it starts with, giving back to your community and serving them, with the best healthcare that we can possibly achieve in our primary care setting. And what drove me to primary care? Well, because, I always liked being sort of the quarterback in school, and also in the healthcare. I like to be the person that they can go to when things aren't quite right, when they're not finding the answers they need from a specialist or someone else, or not knowing where to go to. I think it's a critical role that primary care plays in supporting someone's overall long-term goals and long-term health. I really want to tell you the real reason, though, I got really into medicine was, I had a lot of elderly family members that were in and out of our homes, whether it was grandparents, aunts, uncles. And, I really gravitated towards them. They were so kind to me, and I learned so much from their wisdom. And I believe that older people have so much to offer us in terms of that wisdom. And I just wanted a way to give back to them. It's a privilege and honor to take care of my, my older population as well as my younger population.
Absolutely. Well, that's actually near and dear to my heart, because I am very passionate about helping senior patients as well, from a different angle, helping them with insurance. So when I hear that kind of compassion that you have for our seniors and making sure they have a good care experience and really treating them like your own family member, and that was what drove you to do what you do, I find that really inspirational. And I feel like if you're like a Kaiser patient out there, sitting out there thinking, where would I go for my primary care? Or is somebody out there that can take care of me. If you're anywhere in the vicinity of Alameda County, Dr. Khaira and his team are amazing. And you could definitely choose them for your primary care. So I love that. And I love the sensitivity towards aging patients. That's amazing.
Yeah, thank you. We are in fact open to patients, and that's, I'm accepting patients. And about a year ago, a colleague of mine who had been a hospitalist for upwards of 18 years, I had worked side by side with him in the hospital, came to me and approached me and said, I think I need a change. Hospital medicine, frankly, has been, he was on the front lines of healthcare during the pandemic. I think that everybody can say, "Hey, I raised the white flag," and he, knows that maybe it's not something that he could continue to do, but wanted to continue to practice. So I told him to join me in private practice. He's been with me a year, and the patients love him, and I think that's because he cares. He's very very much a patient-centric physician, and he's the perfect yin for my yang. He's more calm and mild mannered than I am. I'm a little like I got a lot of energy and stuff like that. So he's just a perfect balance for us in our office. Love to have the collegiality, of course, with him, to run patients by him and so forth, and vice versa. So it's just been a really wonderful marriage, if you will. And then, of course, we have nurse practitioners that we've had with us for several years as well, who support us as well. So we work collectively as a team to kind of give a team approach to provide the best care for our patients. So it's really worked out very nicely.
That's really been my experience as well. I know I've referred a lot of patients your direction. And so for agents and brokers out there that are looking to find a primary care doctor, because there can be a shortfall, this team is excellent. And Dr. Magalong, who's also in the office, who Dr. Khaira is referencing, he's like a unicorn, because he's an experienced physician that's actually really growing significantly. And so that's a great option for you as well. But the whole practice is wonderful, easy to work with, and friendly. So I highly recommend them. So Dr. Khaira, now back to you. So tell me a little bit about your background in training. So obviously we got your why. So tell us all the qualifications.
Of course. So I'm boarded in internal medicine, and actually I'm also boarded in hospice and palliative medicine. As I said, I'm kind of gravitated towards taking care of older patients, and so what sort of happened when I finished my residency in Loma Linda University Medical Center. What I did was I joined a practice in Alameda that had a lot of geriatric patients. And what I found was, when they would go to the hospital, I'd follow them into the hospital. I was what they coin nowadays as a traditionalist. Back then, it was just being a primary care doctor. I would see them in the hospital. And then sometimes they'd unfortunately have to go to the nursing homes, where I started following them there too, just to continue the continuity of care, to reduce their vulnerability, and to provide some type of support for them. And then sometimes they ended up having to be on hospice. And I didn't love the idea that I was no longer part of their, primary care, if you will, and felt really disconnected by that transition. Therefore, I studied, I learned, I joined a hospice program, and so now I can provide what I like to say the full continuum of healthcare. From when they are with me and they're healthy, they're doing fine, to and unfortunately even when they pass. I really like to be able to offer that, and so it's been like I've been practicing now for almost 20 years, in private practice. I can't believe it. That's
when you're so youthful. How did I possibly have all that experience?
God. I love it. Don't worry. There's some gray hairs in here. Let me tell you, I've burned every single one of them, and I love it. I think it's just, I love aging for that reason, and that reason alone. God, when I first came out, Aaron, I will tell you, everybody's like, well, you can't be a doctor, you're too young.
They're like, you're 12. How are you doing this? Right?
Like,
I'm a real grown up, I promise.
Yeah. So things have changed. Now they know I'm the doctor. So that's a good thing, I guess,
Exactly. Well, now tell me, Marina Village Medicine, what was the catalyst for starting Marina Village? And I know you do primary care, but you do a lot of other things too. So tell us a little bit about the business.
Yeah, sure. We started Marina Village Medicine. I did, I should say, about 10 years ago. Although with a heavy amount of help from my wife, who supported me in this. I was with a couple of other gentlemen, wonderful physicians. They were pulmonary critical. They are pulmonary critical care doctors. I think what I wanted was I just wanted a larger focus on primary care. From a practice that was even, it wasn't just another thing they did, but something they wanted to do. And so that's kind of where I started from. I said, you know what, how do I provide the best primary care? How do I change people's lives? And part of that actually grew was, I was around the age of 40 when I started my own practice. And my wife was like, why couldn't you just bought a sports car? I mean, you had to spend. And I said, yeah, I know. I should have just bought a sports car. But I really wanted to do it. And one of the things I really wanted was I wanted to, like make a difference and not just do the things that we all frankly do in healthcare, which is hand out the referrals and the medicines and dole out all those things and see you real quick. I wanted to give didactic. I wanted to give data, give information, to empower my patients to make the right choices for themselves, to know what they're going to be up against if they don't. So I thought that was my job as being really as an educator. And so from that stemmed my desire to kind of help patients with weight management. I realized that, we have so many patients whose primary problem is really weight. And weight can actually, and obesity can actually affect up to 10, 11, 12 different medical, complications can come just from that. I think we all kind of know it. And so it was like, what can I do to help prevent some of those medical consequences, such as obstructive sleep apnea, early heart disease, type 2 diabetes, just to name a few, hypertension, of course, too. So what can I do to reduce that burden, that medical burden on my patients? And so, one of the things I love to do is just talk about, weight management strategies with my patients, all of my patients who are part of my practice. Now, some of the patients actually have said, hey, we want to be involved in a medical weight loss program, which I've supported as well. And so we have a medical weight loss program.
And the Ozempic and those kinds of
treatments. We take them and we use phentermine as well. But what I always tell everybody, Aaron, like if my weight loss program is a pie chart, a very small piece of that sliver, a small piece of that pie is actually the medication. Weight management is a multifactorial, problem. So it needs multifactorial, solutions. So, we really focus on accountability, teaching, education, and supporting our patients in the most non-judgmental way. I think they deserve that. That's the biggest thing.
100%
I think they'll get from us.
Respect is everything. So now I know you're a member of the Obesity Medicine Association.
Yes.
Can you tell me a little bit about what that is and what work they do?
It's a wonderful organization, a nationally recognized organization that promotes weight management for patients, and is such an advocate, really, in the medical community. It's essentially where a number of expert, whether they're doctors, nurses, come together and find ways to, improve medical care for obese patients in this country. It's been something I've been proud to be a member of. I've been attending their meetings at all costs to me. I take a week off of clinic to go attend these meetings once a year for a week, and I come back re-energized, rejuvenated, and ready to give the best medical care that we can provide for our patients, especially those suffering from weight management issues. So it's a great organization, and I'm excited that their membership has grown over the past 10 years, and there's a larger focus on this epidemic of our time, the greatest epidemic of our time, really.
It really is. And, it's great. What I like about you, Dr. Khaira, is not only are you focused on this, which is such an important hot topic, but you really invest the time to make yourself best in class in your craft, right? And you just continue educating. collaborating with other providers to
Yeah.
bring the best experience for your members. That's amazing. So Dr. Khaira, I know you work with a lot of Medicare patients. You've been talking about your passion for working with people with Medicare and seniors, and I'm excited. That gets me pumped up because those are the people that I love. Those are my people. Ever since I was a little kid, that's what I've been attracted to, is helping seniors with everything and getting to know them and their stories. And I know you work with a lot of Medicare patients, and you work with Medicare Advantage plans. I know you work with straight Medicare and take people with supplementals. You really run the gamut. But I'm sure as you take patients who are in this dynamic, there's some probably unique needs of Medicare patients. Like, what do you find kind of stands out with your Medicare patients in terms of their concerns and how you address the extra care that they may need?
Yeah, I mean, I think their bigger concerns really, honestly, sometimes do fall on the financial part, and that cannot be ignored, nor should it be by physicians. Our patients are struggling just like everybody else is. Our geriatric patients, they're on a fixed income. We really need to make sure that we're cognizant of it. Let's not start them off on a medication that's going to be $1,000 a month when perhaps there's another alternative medication that will do literally the same thing for pennies on the dollar. So it's being cost conscious. I'm sorry, and really focusing on that along with, of course, the number one thing is their health. But understanding that they've got bills to pay and all the sort, and then also understanding what are from the medical perspective the things that I always learn. One of the proverbs I use always is start low and go slow, meaning that when I do start a medication on a geriatric patient, I always start very low in terms of dosing, and I increase slowly. There's a lot of medications that we shouldn't be using in geriatric populations, period.
And I'm here to tell you about a health plan called Aetna. Aetna is a health plan built on solid ground with over 170 years of experience helping people with their healthcare choices. Aetna offers Medicare Advantage, Medicare Supplement, and Part D prescription drug plans across multiple counties across the country. Aetna is known for their innovative product designs, especially on their medical plans, including things like vision, dental, hearing, and more. It might be time to consider Aetna for your healthcare coverage. For more information on Aetna Medicare plans, please visit their website at aetnamedicare.com or contact your local agent.
Very cognizant of that. If I use them, I have a long discussion with the patient and the family about why were you choosing it, and we'll see how and follow very closely. I think one of the biggest things that I like to do in my practice now, 20 years in, that maybe I didn't do as much early on, was follow people a little closer. If I have a geriatric patient who has a number of medical problems, I'm not going to see them once a year. I'm going to see them maybe 3 times, every 3 months, potentially, sometimes earlier. If there's an acute medical issue, we're going to make sure we figure it out together. And the beautiful thing about, if there's only one really good thing that came out, I think, at least for me, it came out of the pandemic, and that is the application of telehealth. We've been able to provide telehealth to our patients, especially those that are, having a really difficult time getting out of their house. They're sort of homebound, if you will, or just have a taxing time getting a ride or whatever else, and to be able to provide instant care for them via, audiovisual telehealth, just like we're doing today for this conference, is becoming invaluable. I can tell you that there have been several times where I've prevented hospitalizations by being able to be, available for my patients through telehealth. It's been a game changer in that way.
Right. I mean, Dr. Khaira, I just heard like 3 things there that make you an incredible primary care doctor for anybody out there. So number 1 is you do telehealth for those who need it. You also see patients, of course, in the office as well, which is awesome. But I think most doctors, everybody wants to practice medicine and they want to handle their patients and their care. But a lot of physicians don't like to look at the cost of things and the impact to the beneficiary when they get to the drugstore or they go pay their copays or whatever it is. And the fact that you are passionate and you care about that is a super big deal for Medicare patients, right? Because they can really run into a situation where they actually can't afford the treatment or care. And of course, what kind of outcome are you going to get there? And then the final thing that gets me thrilled is this tracking of patients so closely and putting the time in and having that long discussion with them and their family members to make sure that they're taking medications for the right reason and can afford it, and all those kinds of conversations. That's just amazing. So thank you so much for all of that. And I was just thinking, I know you have a relationship with Brown and Toland Medical Group. Can you talk a little bit about what that relationship is? Because I think you have a multifaceted relationship. You work as a provider and you work in another way, right? So can you tell us about how that works?
I do. I've been a provider with them, for a number of years. I want to say 8 years. They've been really supportive of my practice, and by that I mean they've helped me grow my panel of patients. And if you don't have patients to see, then it's really hard to survive. So that's been great. But they've also provided other sources of support as well, through giving us help with best practices or just other ideas with how to save money on our end, so that we can, like, on purchasing of equipment or other things we need to reduce our costs, so that we can stay afloat. We're a small business. We have small business issues just like everybody else. I've become part of their. I'm a part-time medical director for Altace, which is now running Brown Toland, and I really like seeing the other end of it. So in terms of getting authorizations for patients and just kind of having a voice from the battlefield, if you will, of healthcare, of like, how do we provide the best care and how do we allocate the best resources to those that need them? How do we triage better? And being somebody that's on the front lines of medicine, I think it's helpful for them, and I think that's why they chose to have me come aboard. So it's been really positive. I'm really happy to join them.
That's awesome. Recently. Well, I think just having someone with your care and compassion and experience being part of the decision making of figuring out the best treatment protocols, being a medical director, that's pretty incredible. And they're very fortunate to have you in that role. So I'm so glad about that. Now, just for everybody's benefit, I just want to talk for a second about how things work when people are on Medicare Advantage plans. So generally how it works is there's Medicare, and then Medicare contracts with various insurance companies to deliver these Medicare Advantage plans. And there's some very competitive ones in Alameda County and throughout the Bay Area that are available. But how it works is most of these are Medicare Advantage plans that work within a network. And so Brown and Toland is one of those major networks that works within this system. And Dr. Khaira is part of that group. So if you ended up choosing Dr. Khaira as your primary care physician or main doctor, he'd be the quarterback, in his words, and he's a good one, throwing all the touchdowns and making sure that all the plays are called correctly. And he is going to be responsible, or his office are going to administer referrals if you do need to see a specialist. And he's going to be sending you to other Brown and Toland doctors within the network. And one of the things that Dr. Khaira was mentioning earlier is just being cost conscious for Medicare beneficiaries. So right now we're in a dynamic where Part D prescription drug plans are going up tremendously for 2024 for standalone drug plans. People who are on Medicare and a supplement are paying more and more premiums. And there's plans available that work with Dr. Khaira in Alameda County, available at zero premium, that embed prescription drug benefits, that give all kinds of extras. And you can use a physician like Dr. Khaira with that system. And so I was just curious, Dr. Khaira, just to kind of defining for everybody how that works. What's your experience working with these Medicare Advantage companies and with Brown and Toland? Is that providing a good experience for your patients?
Absolutely. I think Brown and Toland is really trying to do the right thing. I think that's why I joined them. Not just by the right thing by the physicians, but the right thing by the members. I think they have recently really tried to start programs and implement initiatives that really focus on prevention and reaching out to the community the members in the community and caring for them, where they need the care. So I think that they're being very judicious with the dollars they spend to try to impact the greatest number of people. and meet them where the needs are most needed. So, I think those are the reasons I really have gravitated to Brown Toland. That's why I chose them as the the affiliation that I wanted to have for our office, and I'm exclusively with them. And so it's just been honestly a nice marriage. I'm very happy with it. And I think they want to do the best for their patients.
100%. And I know as we're talking out there's agents and brokers that are going to be like, yes, Dr. Khaira, Marina Village Medicine. I mean, we're looking for good primary care offices to take patients. And one of the biggest things that I see, and a lot of the referrals I make, are actually people that are moving from a Kaiser model, right? They want to move out of Kaiser, but sometimes that can be challenging, right? You're taking ongoing prescriptions and you're moving to a new system. When you guys take on Kaiser patients, Dr. Khaira, what's the process? If somebody wants to get attached to your practice, they select you, and then how soon can they get a first appointment and that kind of thing to manage medication? How does that work?
Well, Aaron, they can get in pretty quickly. We can get them in, sometimes as early as a week, sometimes 2 weeks. I know that a lot of providers are having a tough time, and we're no different there. And that's why I was so happy to get Dr. Magalong aboard, because, my waits were getting a little longer. But we can get you into a provider pretty quickly. And that's saying a lot when some of our other colleagues are really struggling with that, up to 6 months to get into a primary care in many of the offices in the Bay Area. So I pride myself on meeting the needs and attempting to meet the needs of our community, and trying to get patients in as quickly as possible. We have an electronic health record system. We will get integration of a lot of their medical healthcare information through ours, and so they don't have to get copies of their medical charts and stuff like that. So it makes it a little easier, I think, for patients and so forth. So,
well, I can attest in referrals that I've made that the onboarding experience, so to speak, is really good. Dr. Khaira has built an excellent team of care providers and office staff, a whole team approach to making sure that everybody gets what they need. And agents and brokers, if you're looking for a good doctor in Alameda County, Dr. Khaira, Dr. Magalong, or anyone of the care providers at Marina Village Medicine, what an amazing team. So now, Dr. Khaira, I got to ask you. So I know, first of all, I know you're a Warriors fan. So yes, I love that. I've got a big passion for the Warriors as well. So I was going to ask you, you're a very busy man. I know you've got a big family. You're working as a physician, running a big practice. You're a medical director for Alteus. You're kind of doing it all. But I'm wondering, when you're not working, what do you like to do for a good time? What's fun for you?
Right. I mean, I've got kids and they're teenagers, so it's all hands on deck, right? But so, not a ton of free time, but when I do have some free time, I love to catch a Warriors game. I mean, oh God, here we go. I'm excited, even with CP3, and we'll see how he integrates into the offense, but very excited to have him aboard. And also just, there's, our Bay Area is it's a playground. I mean, of activities for adults and young alike. I like to go hiking with friends. I like to stay fairly active, I guess, when I do have some free time. I mean, so that's important to me, exercise and keeping fit. But also catching some Niner games. They're fun to watch too. So just on TV.
They're looking great. They're looking good. They creamed the Cowboys the other day. What were we worried about?
That was crazy. I don't know. This is unprecedented. It's really nice to be in the Bay Area these days.
I know. We're very spoiled and we love it. So, well, if you could leave us with a little bit of advice on how to better care for ourselves, like 1 or 2 tidbits that everybody could take home today, what would you share?
I mean, I think everybody can benefit from really good sleep. Make sleep a priority. Practice good sleep hygiene. Go to bed at the same time, get up at the same time. And do all the things in between that you need. Get off screens and all that stuff. Secondarily, get a little bit of exercising. It doesn't have to be, where you're running, a marathon. No, it's very simple stuff. If you're very sedentary, you don't know where to start simply, go for a 5-minute walk, go for a 10-minute walk, just start somewhere. And then, eat well balanced meal. I love I love that Confucius saying that the Okinawan Japanese people say to one another at the dinner table. I've heard, and that's a blue area. Apparently, it's where some of the longest living humans are on Earth. And they say Hari Hachi Bu, and roughly translated, it means eat until 80% full.
Oh, very interesting.
Wonderful.
You got advice, Dr. Khaira. I'm going to take that one to the bank.
I think we could all use it. I just don't know if we should be saying it to each other at the dinner table, but that's a different story, and we can talk about that later.
Maybe say it outside of when you're putting the food in your mouth. Like, are you sure you're not at 85?
I know. I don't know if that'll go over too well at my dinner table.
Oh my gosh.
But
Well, Dr. Khaira, you are wonderful. Marina Village Medicine, such a great team. If people out there want to recommend their clients to come to be patients at Marina Village, or patients out there are looking for a new home, a new doctor, where would you direct them to go?
Absolutely. Just, check out the website. We pride ourselves on that. So www.mbmedicine, like on screen. And also you can call our office, 510-227-5540. We have real people that pick up the phone. So sometimes you'll have to leave a message because they're talking to somebody else, but they will get back to you that day and get you in as soon as we possibly can. And we look forward to seeing you.
You guys are amazing. And everybody who answers the phone, everybody I ever talked to in Marina Village Medicine, all has the same attitude of you, Dr. Khaira. So it starts at the top. You have created that culture there, and we appreciate it. So for everybody listening out there, MV, M like Marina, V like Village Medicine, all one word, .com. And Dr. Khaira, can you repeat that phone number one more time?
Sure. 510-227-5540.
All right. You heard it here. Dr. Khaira, thanks so much for your time. You're such a pleasure. Thank you so much for joining the show. I appreciate you.
You're welcome. Thanks, everyone. All right. Bye, Aaron.